Hello, thanks for joining another one of our faculty wellness nutrition meetings. Today we have Brandon Welch. He's from Sports RX Network. And welcome and thank you for joining us.
It's a pleasure. So here's some of the objectives that we're going to highlight throughout the presentation. I'm going to give our audience a good snapshot of my roadmap to becoming a sports pharmacist, the role that I'm in today. I'm going to define the practice of clinical sports pharmacy. What are some potential practice sites and responsibilities for clinical sports pharmacists? And then most importantly, I'm going to discuss some ways and opportunities for you to get involved. So here's a little bit about me. I am a clinical sports pharmacist for one of the largest health systems in South Florida. We are the sports medicine provider for a lot of the major teams in South Florida. So Miami Dolphins, Florida Panthers, and a few collegiate teams that we support. I'm also the president of the Sports RX Network. I have my own independent brand called Pharmacyathlete, where I help support a lot of recreational athletes in collaboration with a sports dietitian. And I also sit on the advisory board of the Society of Sports Neuroscience. A little bit of my background. I did graduate from the University of South Florida with a bachelor's in biomedical sciences. Then, because I decided that I wanted to stay a bull, I went back and got my doctorate degree from University of South Florida. Then I went back to school and went to the University of Florida, and I started pursuing a master's degree in kinesiology and physiology with a concentration in human performance. And so with that additional degree, I've always tried to identify opportunities of how to marry and bridge the two between sports and pharmacy to help athletes perform at their best. And here's a few certifications that I have at the bottom. So let's talk a little bit about my roadmap, where I started and how I got to where I am today. And so, as I alluded to a little bit earlier, I graduated from the University of South Florida. And I feel like a lot of my experience or where I am today came from, believe it or not, when I was a pharmacy student. And so I used to educate and also offer free exercise advice to a lot of my classmates. And it was a good way to kind of, get my feet wet into what I would have never thought of the role that I'm in right now as a clinical sports pharmacist. Right out of school, I went straight into retail. Mainly a lot of my years spent were as a retail pharmacy manager. So I worked at a lot of the wholesalers. So I worked for Sam's Club for a few years as a pharmacy manager. And then I also worked at Costco. And one of the things that I quickly realized is that a lot of my impact came from me being in front of the counter versus behind it. And what exactly do I mean by that? And so I did a lot of education around supplementation. It was always funny seeing some of the members or customers say, "Hey, I never see a pharmacist out here in a white coat asking, do I have any questions about supplements?" I mean, sometimes we forget supplements is a $1 billion industry, and there's a lot of myths and facts when it comes to supplements. And you being, for lack of a better word, potential expert in supplements based off of the degree you obtained and other outside information that you sought out, and being able to vet the quality of evidence. I mean, it puts you in a really good position to help educate patients or members about the effectiveness of certain supplements, and then also looking at if any of these supplements interact with any other medications. And I had the good grace too of working in a market where I had a lot of 40, 50-year olds who were very competitive athletes coming into the store asking about different supplements to help with their performance. And so, really started with that too, giving me some good education on how to interact and identify the needs of my patients. And so that really drew me to, you know, obtaining a degree at the University of Florida in exercise science, our kinesiology and physiology. And, if I didn't mention already, like I've always had a passion for sports. Growing up, played a lot of travel basketball. And so to be able to still have that child prodigy and that experience, growing up and to kind of bridge it into my experience as an adult was always a beautiful thing to me, is because I always say it starts with having a passion and love for what you do, and then pairing that with expertise. The message comes off a little bit more genuine, understanding how to relate with yourself in the athlete's shoes as you're educating them. And that also led me to the development of my brand, Pharmacy Athlete. It started off with me just doing a lot of social media posts whenever you're starting something new. I always say that it's best to just get started somewhere. You don't have to have this perfectly made model right away, but at least if you start somewhere and just kind of get your name out there. And so I started doing a lot of social media blogs, Facebook, LinkedIn, a lot of education behind the clinical efficacy around sports supplements, and then understanding what supplements are on the banned substance lists. And that led me into creating the Sports Pharmacy News, which is, a media outlet where we have our monthly magazines that highlights a lot of these topics: health, wellness, supplements, opportunities for pharmacists to get into. And it's peer reviewed, and I got a lot of good traction from it. And believe it or not, it kind of opened up some doors and eyes to the people that felt like my services were needed the most, which were the sports medicine providers. And so that's what led me to the job I'm in today with Baptist Health South Florida, is between the sports medicine provider, the chief pharmacy officer, identifying a role for a pharmacist being in a sports medicine clinic. And a lot of my role revolves around, educating athletes around health and wellness initiatives, evidence-based supplementation, understanding whatever the appropriate pharmacotherapy intervention is for the athletes, which we'll talk about a little bit later. As we know, there's a bunch of different classes of medications, and there's a lot of medications in those specific classes. But one of the things you always have to keep in mind is what's the athlete's demands, because it's not typical for your normal patient. And you always have to keep that in mind, is because you always want to choose something that a pharmaceutical agent, when it's needed, that's not going to impair or interfere with their performance. And we forget that, look, athletes, they're humans too. They have chronic conditions, they deal with illnesses. And so medications are often needed. And so through these experiences, I always say, in life, your experiences sometimes can be building blocks to your career long term. And through these experiences, it's really helped me define, okay, how can a clinical sports pharmacist help with an athlete? And whenever I say athlete, I always like to make it very clear. I'm not just talking about people who compete at the high level or who are in professional sports. Anybody who's a recreational athlete. So it can be your weekend warrior. It could be your fitness guru. It can be your person that plays intramurals. I mean, I like to broaden the demographic scope here when I define an athlete. But the bigger message that I want to drive home here is that with this being a new role, it's important that we always remember this role that I'm in, or anybody who tries to pursue the role, is that this is a interprofessional team. And so it's not me trying to spearhead all the decisions. It's me working in collaboration with the athletic trainer, the sports dietitian, the sports medicine provider. and following this concept with called shared decision making. How do we come up with a customized, comprehensive plan, right, through good communication to help optimize the care for the athlete while also mitigating or minimizing their side effects? So whenever we think about entrepreneurship, with pharmacy, there's a lot of ebbs and flows. And so when we think about how do we become innovative, sometimes it starts with these new initiatives that we're bringing to market. And, I strongly believe that, sports pharmacy is constantly emerging right now in the industry of pharmacy, and I see it creating good roles and opportunities in the future. University of South California, USC, they just hired a sports pharmacist in the world of academia. That's one practice setting, and we'll go over the variety of practice settings later in the slides. And I work in an ambulatory care setting. I work for a health system. One of our advisory board members, Jessica Bill, she works in a community pharmacy setting. And so there's a lot of different opportunities and avenues to essentially help acclimate or implement yourself with some of these initiatives, marrying sports and pharmacy. So what is sports pharmacy? I always like to say it's a branched specialty. So it's not much different from, how you have a pharmacist that goes to residency and, specializes in cardiology, oncology, endocrinology. I mean, the list can go on, neurology. And so I consider sports pharmacy as a specialized branch that deals with a, specific demographic of people, right? Again, athletes, sports teams, your weekend warriors, your recreational athletes. There's a bunch of different sports injuries that happen. And understanding what those pain descriptors are when these athletes get injured to help optimize therapy is going to be key. Um, Even your typical person that does physical activity that may come in with, osteoarthritis, that is still under this bubble of sports pharmacy. And so there's a lot of, different areas of how we can, optimize this domain of sports pharmacy. But the bigger message that I want to drive home that it's a specialty, it's evidence based, and it could be a very fundamental piece when it comes to, optimizing the health and performance of people who want to compete at high levels. So what's the goal? We want to optimize the health, performance, safety, and overall well-being of what I like to call our patient athletes. And so when we think of health, right, I always say health is the catalyst to performance. And so if you want to perform at a high level, your best ability is your availability. You got to be healthy, right? And so understanding how do we keep our athletes healthy? And a lot of this can be with, athletes, they have physicals, just like how we should be doing our annual physicals. And, a huge part of my role is, looking at, an athlete's past medical history, family medical history, or even current medical history, and figuring out what are good labs to order for the athlete through my collaborative practice agreement with the sports medicine physician, and also making clinical recommendations with the physician through shared decision making. And sometimes, this can require, depending on where the labs are, this can require, pharmaceutical intervention, or this can require a consult with the sports dietitian. There's a variety of different ways of recommendations that we can make for these athletes. And then, through optimizing their health, a byproduct of that is their performance. And then safety. Safety is very key, is because, athletes, a large portion of them take a lot of supplements, making sure that through our areas of expertise, we understand what could some of those drawbacks be with some of those supplements, understanding what supplements are considered safe and not on the banned substance list. And there's governing bodies, right? There's the WADA, World Anti-Doping Agency. There's USADA, United States Anti-Doping Agency. So there's a lot of resources for us to tap into to help make good clinical judgment when it comes to educating these athletes on appropriate supplementation. There's certain labels and seals for us to look for, like NSF certified, informed choice. Like these are gold standard labels to make sure the athletes are taking safe products. The last thing we want to do is, recommend a product that isn't safe, that costs them not only money, but also costs them playing time because we didn't make appropriate recommendations for a supplement that could be taken. And then most importantly too, optimizing their overall well-being. Athletes have a lot of different commitments. They're constantly traveling in and out of different time zones. They're in different geographic areas. They're practicing 6, 7 days a week. They're away from their families. So, family commitment is at a risk. And so understanding that, hey, these athletes, they have a lot of external and internal stressors. Understanding how to help navigate and triage care is going to be key to protecting the overall well-being of athletes. Now, what's a good way for pharmacists to really get involved? So medication management is very essential. Some of the top conditions I see a lot of athletes suffer from is depression and anxiety. Anxiety is a big one, is because they're constantly either, being scrutinized because of a bad game they had. These guys, they have playoffs, they have championships. Sometimes these top pick rookies, they're playing for the first time and they're mounted with all of this pressure. And sometimes they got to take medications for anxiety. But where the pharmacist comes in at is, okay, what are those appropriate medications for them to take that's not interfering with their performance? Baseball players is a huge, huge, huge sport that deals with a lot of depression, as you can imagine, thinking about their season. They play close to 200 games a year, so they're constantly training and playing in the games, at least 8 or 9 months throughout the year. So they don't really have a whole lot of time off. And so oftentimes that can require them to be on, antidepressant therapy. And so we want to make sure we're choosing the right antidepressant for that particular athlete and understanding what are those side effects that can be impacting their performance. And so that understanding of drug-induced nutrient depletion is going to be key. And this is how the shared decision-making or communication with the sports dietitian becomes a very pivotal piece. There can sometimes be adverse drug reactions that can happen from certain medications that are on the banned substance list that may be required for an athlete to take can require what's called a TUE, a therapeutic use exception, which pretty much means when an athlete has a medical diagnosis and they need a certain treatment that's on the banned substance list, a pharmaceutical drug, then this form has to be filled out in order for them to take it. And the biggest class of medications that come to mind is the stimulants. There's a lot of athletes that suffer with ADHD. And so, through our medication reconciliation that we have on these athletes, these are things that we have to catch and communicate with the sports medicine provider to make sure the right paperwork and form is filled out. Orthobiologic therapy is becoming a innovative approach to, muscle pain or any type of sports medicine injury. So the hyaluronic acid injection, there's a variety of different HA injections. And so a part of my role is understanding what HA or hyaluronic acid injection may be appropriate for the player. PRP, platelet-rich plasma, that's another orthobiologic therapy that's probably been going on for a few years. But a part of my role is help building medication protocols behind that. And so there's certain medications that interact with platelet-rich plasma, and some of those medications may need to be suspended for a few days. And, a common class of medication that interacts with platelet-rich plasma is NSAIDs. NSAIDs, blood thinners. I even look at supplements. So any supplements that can potentially be thinning the blood, I'm very proactive with it. Fish oil. The reason why I bring up fish oil is because a lot of athletes take fish oil. And so I know at mega doses, fish oil can thin the blood. But I, just to be on the conservative side, I have a lot of my athletes just stop fish oil for a few days to help optimize those platelets to help with the procedure of the medication. Then stem cell therapy is another one. But these are other, for a lack of a better word, off-label therapies or procedures that are done to help optimize muscle recovery or any type of sports medicine injury that the athlete may be having. So what are some of the clinical services that can be offered to some of these athletes? Medication therapy is one that we just talked about. And, if I can speak from the context of anybody who may be, an independent consultant or who may be in community pharmacy, there's a big need for what I like to call these master athletes. So these athletes that are over like 40 years old that are taking blood pressure medications and statins, right? I've seen a handful of athletes come in, these master athletes that come in with very bad muscle pain and muscle cramps. Come to find out, doing a med rec, they're taking statins. And I see a lot of this overtraining syndrome where they're overtraining and under recovering, which is leading to that excessive breakdown, and you're starting to see these CK levels highly elevated. Another common class of medications that I see that impact these master players' performance is your ARBs. So like your losartan and your valsartan. So valsartan can increase your blood urea nitrogen levels, which is a good indicator for dehydration, right? And so sometimes I'll see these levels very elevated, and again have these athletes that have these bad muscle cramps and starting to feel very fatigued throughout the duration of the race. And so I'll have to constantly, counsel these patients on the appropriate hydration strategies in collaboration with the sports dietitian. Or sometimes it may warrant us to just switch the therapy, going to an agent like a calcium channel blocker, like an amlodipine, that may be just as effective, right? That doesn't have that side effect of your blood urea and nitrogen levels increasing. Building these collaborative practice agreements with your local, sports medicine provider can be key. Sleep disorders is a big one. Especially with the jet lag, we honestly try to avoid a lot of the benzodiazepine or non-benzos, such as your temazepam, zolpidem. A lot of my guys, I've switched them to Ramelteon, which is, prescription strength melatonin, which mainly targets selective M1 and M2. And the reason why I bring this mechanism of action up is because I always get the question, what's the difference between the over-the-counter melatonin versus the prescription strength one? Well, the over-the-counter one is non-selective towards your M1 and M2 receptors, right? But the prescription strength one is more selective, helping it to be a little bit more effective with calming the player down to help them promote sleepy, healthy sleeping behavior. Bacterial infections, right? Even though it may be a small incidence of, tendon ruptures, which are fluoroquinolones, we completely stay away from them. And so keeping that in mind, some of our antidepressant medications. So some of these medications cause QT prolongation, right? Some more than others. And so we try to stay away, again, trying to be conservative, considering the athlete's demands and the sport that they're playing. We try to just be very conservative and caution when it comes to some of those side effects that you can get from some of these medications. Interpreting labs, sometimes, in collaboration with the sports medicine provider, or if the patient's willing to come in and you're able to charge a consultative fee to help interpret the labs and try to, again, pair that health with performance piece. And then also looking at their medications, which could be impacting some of their blood biomarker levels. Um, you always have the opportunity to do pharmacogenomics. I think that's a upcoming and growing market. I do quite a bit of nutrition genomics as well, to make adjustments to either the pharmacotherapy or nutrition with the sports dietitian. Test and treat, the point of care testing. Again, that's a good avenue. Athletes, the second leading cause of athletes missing games is illness. So being able to expedite this process and initiate therapy for these athletes, appropriate therapy when an athlete may get the flu or may get COVID, um, could be a huge help when it comes to supporting athletes. And I'll give you a good example. Um, when it comes to our athletes getting the flu, right? I actually stay away from Tamiflu, and here's the reason why. Tamiflu takes at least 5, 7 days to work in order for it to help with the flu. Zafluza, even though it costs a little bit of money, works, within the first 2 days. But again, the reason why I use this therapy and it's been, very effective for the athletes is because, these athletes can't miss games. And so sometimes it's not always about cost. It's about how do we effectively treat an athlete while also getting them back on the field, minimizing the side effects as much as possible. So sometimes, you can use your leverage and you don't always have to think about costs as long as it's not an exorbitant amount. If it's only, I don't know, $50 to $100, I don't think the team is going to cringe over that, especially if it's a star player. So when you're evaluating an athlete, these are some of the things that you got to keep in mind. Administration of vaccines, COVID, flu, this is part of our jobs already. Especially during off season, I get a lot of questions around travel vaccines, which is a huge one. That's becoming very popular. At least for your high school athletes, there may be an opportunity to do, health screenings, blood pressure checks, cholesterol testing, glucose monitoring. Maybe you can work with, your local sports medicine doctor that does their sports physicals and find an opportunity to help out with any type of health screening services that they may have. Um, a lot of athletes in certain sports that they play, I use hockey, baseball, they may chew tobacco, right? And so this could be a good opportunity for smoking cessation, right? For you to intervene in nicotine replacement therapy. Sometimes you can work in collaboration with, your exercise physiologists and looking at some of their health data. The biggest thing I mainly focus on is mainly the sleep data, right? And helping with the muscle recovery process. If someone's having a hard time sleeping, I think it's more than appropriate for a pharmacist to educate on sleep hygiene tips without, stepping on anybody's toes. And if those things are not working effectively, maybe there's some over-the-counter products that you can recommend, or, some non-harmful pharmaceuticals that may be appropriate for the patient. There's a small handful of athletes that have type 1 diabetes, right, who may be on a continuous glucose monitor. And so, there's that opportunity to help interpret some of those blood glucose readings and interpreting them to the dietitian to help come up with a periodized or program nutrition plan to help optimize their performance. So these are just a few variety of ways that we can definitely get involved with the athlete. Patient education, again, evidence-based non-pharmacological strategies to help optimize nutrition, hydration, sleep, and recovery. I mentioned the sleep hygiene tips, making sure too, there's evidence-based supplements that you recommend. So these are some good opportunities of education pieces to offer. And then, back to the banned substances, there's a lot of different governing bodies to kind of pick from. So you got the World Anti-Doping Agency, you got USADA, you got NCAA, they have their own rules and regulations. And then for some of the professional teams, they have what's called your CBA, collective bargaining agreement. Being able to pull from those resources is going to be key when you're educating the athlete on what's the appropriate supplements to take. Here's just a small snapshot of all the different ways we can be involved in an athlete's health. I'm a huge advocate. I can't stress it enough of adding a new player to the team, sports medicine team, of being of a good resource, an effective resource for an athlete's health and performance. And here we are, here we are, the clinicians that we have the ability to be. And I think that there's a lot of value that we can offer in order to be a part of that athlete's healthcare team. What are some opportunities for the practice model? We know that through a health system, it can reduce costs, provides good patient care, and increase access to care. Increase access to care is probably the highlight that I would like to focus on, is because we are very accessible. We're the last line of defense providers, and we know that doctors, they're tied up doing a lot of things. And so establishing those relationships and showcasing the value that you can bring to an athlete's health and performance is going to be pivotal to your approach, and pivotal to you essentially getting into this space and build on top of it. So what are some examples of establishing a sports pharmacy practice? It starts with, again, establishing those relationships with key stakeholders, whether that be sports medicine providers, orthopedic providers. Osteoporosis or osteopenia can be another big one, especially for a lot of your female athletes, or some female athletes suffer from a condition called relatively energy deficiency syndrome, which is often could be diagnosed by the endocrinologist, which is another opportunity for us to help support, or it can be diagnosed by the sports medicine provider. But we know that female athletes, they're at the highest risk of fractures, right? And so this can be a good opportunity for us, as providers or pharmacists, to help support some of these healthcare providers. Negotiating conditions, whether that be through a standing order, a collaborative practice agreement. What are some of these clinical services that you can bring to help support the sports medicine physician? Work in sports pharmacist practice. All right. So, I talked about sports medicine offices, which is kind of where I work. You have primary care offices. I'm sure that a lot of, athletes go see primary care. Probably more of your high school athletes may see primary care for some of their sports physicals. We're starting to see, at least internationally, there's sports pharmacists that may work for the IOC, or some of the anti-doping governing bodies, such as United States Anti-Doping Agency, or WADA. So that's an avenue. Potentially serving as a consultant for a sports team. Academia. Academia could be a good wave for pharmacists to get involved with, is because, you have the athletic training department that you're supporting. You're also teaching, then you're also being able to do some research. So there's opportunities there. Community pharmacy, which is what I kind of alluded to a little bit earlier. You can do the pharmacogenomics testing, by doing a medication reconciliation review, seeing what medications could impact the performance of an athlete. And then, adding on the pharmacogenomics. Pharmacogenomics, I can't stress it enough. It could be a really good opportunity, especially, again, with those master athletes that are taking, statins and certain blood pressure medications, and them being at a higher risk of certain side effects. Could be a good segue or relationship builder with their provider. So here's a little bit about, sports pharmacy network. If you're ever interested in ways to get involved, we have good partnerships too with some of these anti-doping agencies. Specifically, USADA is a good one. But I have up here just the slide deck for pharmacy owners, but there is a membership for allied health professionals. There's a membership for pharmacy techs, pharmacy students, and or just regular pharmacists on ways to get involved. And I think for us, it's one thing to talk about something, but I think too, people really want to know, okay, what's the resources I can get access to in order to actually provide these services in, the setting that I work in. And so, we have clinical clinical case studies based off of our experiences, so that way you're not only getting the knowledge, but you're also understanding how to apply it. We have what's called our supplement protocols, which you'll see in one of our future slides, where we create these protocols. Our sports dietitian with evidence-based research to help guide good recommended therapy for some of the patients that you may see. We have our newsletter. We have access to our magazine. Then we have webinars talking about this stuff, and then we have a breakdown list. Okay, what are the things that I need to do to help me be successful or prepared to provide some of these services in my community, whether that be me trying to be a sports pharmacist as a full-time job in a particular setting, or whether that be me trying to build some of these services out in my particular practice. And we have a little community, right? And we have a community of people who are doing this that you can kind of pull resources from or ideas. We also have our first live conference coming up in April over at Nova Southeastern DeSantis building, where we're having, a lot of different healthcare professionals that are in the sports medicine field, including pharmacists, that are talking about what are some ways or giving some good education, CEs on, opportunities for, sports pharmacists, and how do we collaborate with other sports medicine providers in the field to help optimize the care of the athlete. It'd be a good way for you to network, connect with people. Like I said, it's not limited to just pharmacists, speakers. We have a sports cardiologist, we have a sports medicine doctor, we have dietitians, we have a PhD, we have exercise physiologists, you name it. They're speaking at the conference, and our whole theme around this is exactly what we practice, which is interprofessional work or interdisciplinary practice in order to optimize care of the patient. And this is an example of some of the protocol sheets that we have. We call it just the evidence because that's exactly what it is. We go over the mechanism of action. What are some diets that we can pull from in order to get these dietary supplements from food? It's always a food first approach. What are the facts? What are the myths? Drug-induced nutrient depletion protocol sheet, collagen, and we have many more. But all these resources are accessible as a member. Here's just a few examples of the magazine that we have available. So we talked about concussions. Our most recent one was the interdisciplinary collaboration, and then the Olympic edition we did in a collaboration with the United States Anti-Doping Agency, which was a really fun issue, and I highly recommend for you guys to check out. And here's my last slide here. I mean, if you guys want to learn more about sports pharmacy, you can scan any of these QR codes. You can simply just subscribe as a member. It's free, doesn't cost you anything. Just kind of stay up to date on a lot of the relevant literature that's coming out in regards to sports pharmacy. Or if you want to join a growing community and be a member, that's always an option as well. Or if you have any questions at all, I'm an open book and I'm a free resource. Feel free to go ahead and email me, and we can, talk out ideas. I'm more than happy to discuss any additional information that you may have. One of my favorite quotes here: if you can't visualize it, you can dream it. There's some way to do it. And that's all of my slides, and then I'll kind of leave the floor open to questions.
Thank you for that. summed up a lot. Especially, I'm a geek where pharmacists can use their education, and this is certainly one that we have not discussed before, so thank you.
You're welcome.
I do have a question though, which I did not know, and you piqued my interest, so there's a prescription melatonin?
Yep, it's called Rameltion.
Melatonin.
Well, that's right. There is. That's right.
Actually, believe it or not, more insurance companies have picked it up. So it's finally now covered, because before the problem is that, it was this prescription melatonin and insurance companies weren't covering it, and it was going for like $200-300 a bottle out of pocket.
Okay. When did that come out?
Oof, probably 2019, if I'm not mistaken. So probably about 5-6 years ago, but it's been out for a little minute.
Huh. And so what do you see, just the less potential side effects, but the same?
So actually, there was a study done head to head against Zolpidem. Same results, less side effects. Now, if you have majority of people on Zolpidem or Ambien, I mean, it was a easy switch. Which, Ambien, it's a commonly prescribed sleep med for a lot of these athletes. So good way to get them off it without them having the brain fogginess or sometimes the headaches when they wake up from the medication.
Is melatonin itself allowed in the whole, I guess I'm gonna say list of I'm diving into that area myself next, but the list
It's
of
legal.
It's legal.
Yeah, it's legal.
Huh. I'll be darned.
Which is another benefit.
Yeah, for sure.
Yeah.
Why? I mean, melatonin is good as an antioxidant and so many other things other than sleep. So
Yep. It's a great choice.
yeah. Oh, thank you for that.
Yeah.
Yeah, Brandon, good talk, good presentation. Congratulations on getting your profession to go where you want it to go, or your career. That's good. Just a couple questions is that, so where do you make your money to make your living? And maybe you covered that, maybe I didn't hear it. I mean, you're not making it off the product, I assume. So how do you get paid? And or is it cash, insurance, or how do you do that?
So through my consultant business, Pharmacyathlete, everything's cash. So I evaluate labs. It's a consultative fee.
Okay.
So excuse me, tongue twister. I'll evaluate labs, and then I'll also, a lot of my athletes here, they like to do the nutrition genomic testing. And so, that's a cash pay service. And so between the labs, pairing it with the nutrition genomics, is how I charge. Again, the master athletes, you'll see the pharmacogenomics more so needed there. Not so much for the collegiate high school guys, but yeah, those are the different avenue streams. And then I have my full-time job as a sports pharmacist for Baptist Health South Florida, which is obviously, salary paid through them.
Right. So you don't support any you don't, after you do their nutrition analysis or what you're doing, your labs, you actually offer your own recommended and ship their nutritions to them or anything like that?
Yeah, so supplements. So I use full scripts. Yeah, I'll use full scripts for any supplements that I'll recommend.
Okay. Yeah, it's good. And then are you seeing, I always said that, pharmacy is pretty much, I'm gonna say, underrated knowledge. I mean, we got so much knowledge, and it's amazing. I always said with the pharmacy education that I got, it's phenomenal. And I thought there's always a lot of different areas we could do things. And have you had any pushback from people to pay you for your consulting type work? I know, a lot of us got to go to an attorney, and I don't see too many people pushing back when an attorney says they have to charge $300 an hour.
Yeah.
You got to get a will. And I guess you could say, hey, is there a third party company that's going to end up having you do it for $75? Well,
Right.
I want that $75 will or trust, right?
Yeah.
So I've always said that, and a lot of people, oh, it's not covered on insurance, you can't do it. And I get in these argument discussion with some of my board of directors here at PBA Health. But anyway, have you seen any pushback with regard to that? I
haven't personally. and just to be fair, a lot of that could have to do with my background. Um, I have the background in exercise science. I'm certified to do a lot of this stuff. So in all fairness, but generally speaking, especially with pharmacogenomics, I don't think you should get any pushback at all. It's definitely within your scope of practice. The reviewing labs, I think that can easily be a consultative charge. I don't know how, as long as you're not changing any drug therapy and you're just giving recommendations. And when I say changing drug therapy, that's if you don't have a collaborative practice agreement in place, then I don't see much pushback. And then, also creating meal plans. Like I don't create meal plans. Like if I see someone wants a prescriptive diet, or
Yeah.
if there's a diagnosis like bulimia nervosa, where like, hey, you have an actual diagnosis of something, then I refer them to a dietitian. I think the most important piece here is making sure you have those referral networks available. Is because you're not going to always know the answer, but I think what's going to make you more valuable is at least knowing where to refer the person and referring them to the right place.
Okay. One other question, it might be self-served here to asking it, but for these athletes that they want to make sure that, a lot of times, like say with baseball, they can go longer, maybe football is a shorter, maybe even soccer kind of shorter, but lifespan of their career. What do you recommend they do to continue to keep their joints lubricated or their cartilage in place besides, not getting hit, of course? So what do you recommend? I mean, we always hear this glucosamine chondroitin. I take that. I'm an athlete. I've had scopes done on my knees, partial knees. I had, torn labrum, torn rotator
Oh
cuff.
man.
Yeah, I've done it all. I got the frequent surgery actually card. I should at least get either the next surgery free, or I should get at least a dozen donuts. That keeps he's the orthopedic surgeon I go to. He's actually the doctor for Sporting KC, the soccer team here in Kansas City.
Okay.
So Dr. Scott Llewellyn, sometimes they'll interview him when Patrick Mahomes on the Chiefs or something gets hurt or whatever. But anyway, so what do you recommend for these, or are they even concerned about that? Because last thing they want to do is they want to go out there and play football or soccer or baseball for these years, and all of a sudden end up in a wheelchair at 45. You know what I'm saying? Because I look at Salvador Perez, the catcher for the Royals. I'm surprised he's still able to bend down there and catch the balls as catcher. But what do
Yeah.
you recommend on that? Are you seen any studies out there with that? I mean, like I say, I take glucosamine chondroitin. How do you know it's really even working? Or collagen? What do you recommend these guys, or do they even mention it to you?
I mean, I typically recommend the collagen. Specifically, I don't know if you heard of vital proteins, is because what makes the collagen effective is the amino acid profile. So it's the glycine, proline, hydroxyproline.
This one
Making
here?
sure that, yes, there you go. Yep.
That's what
Collagen's great. And then turmeric. There's been good studies out there that show
turmeric.
turmeric. I stay away from the glucosamine and chondroitin is because I think the evidence is very scant. There's a lack of evidence that proves a good case for it. So I actually don't recommend it at all. Now, a lot of athletes are doing the hyaluronic acid injections,
Yeah.
which
That's
those help the joints stay lubricated, but that's usually through a specialty pharmacy, or some of them are using the workers' comp. But my general recommendation supplements are collagen and the turmeric.
Yeah. Okay. Yeah. I've had the Orthovisc, Chemvisc, Euflexa.
Yeah.
I've had all those, whatever the insurance would cover at the time or whatever. So I've done all that. Collagen, I find out it seemed like orthomolecular, the one I used to get from those guys that, ACA has and some endorsement with, and we do here at PBA as well. It seems like it worked better than this vital proteins, but it does have some hyaluronic acid in it, I believe. And we've always questioned whether it's bioavailable oral. There is a liquid out.
Yeah, the aura I don't think is really that bioavailable.
Right.
You got to realize collagen's a large molecule, and so it's poorly absorbed. And so if you look at the back of most collagen capsules or pills, I mean, you got to take like 5 or 6.
Oh yeah. Yeah.
Yeah.
I gotta mix like teaspoons full of this stuff in my tea or whatever if I'm gonna drink it during the daytime, this vital protein.
Right. So yeah, those are my,
So people are getting some relief out of that or some benefit out of that you see, that you deal with.
yeah, those are I mean, the dietitian, again, him and I, we bounce ideas off each other, and we're in alignment with our same approach, is that definitely the turmeric and the collagen.
Yeah. Okay. All right. Yeah. I think the chondroitin that I have has some turmeric in it, so maybe I'll just switch over to turmeric when I'm done with this one. So
Yeah.
okay. Well, thanks for that personal, information. And yeah, presentation is really good. Congratulations on your career and everything you've done. You've done a great job.
Thank you. I appreciate that.
Yeah. Linda, you there? She might be at lunch. I walked away from her desk.
Oh, here she is.
Oh, there she is.
I am here.
Okay. I assume you were the moderator, so I didn't know if we'd call back to you or not. So.
Actually, Hillary's the moderator.
Oh,
so-
Hillary, sorry. Sorry, I
Okay,
came on
fine.
2 minutes late. Sorry about that, Hillary.
No worries, no worries. Well, if no one else has questions, I think we'll wrap it up, but thank you so much.
Yeah, it was
I
great.
appreciate that.
Oh, you're welcome. It's a pleasure presenting to you guys.
Okay.
And then,
have a great
yeah,
week.
we'll send that recording to everyone who registered, and if they have questions, they can reach out.
Awesome.
Thank you.
All right. You're welcome.
Everybody. See
Thank
ya.
you so much.
Take care.
Bye.
Bye.